So Chet here from Avion Technology here in the Chicagoland area. We are a digital agency that works with other agencies to help scale them up, turn them around, make them more profitable. We also work with a lot of other small businesses to give them a really good digital presence, whether that's a website, an app, or digital marketing. So today I'm going to talk about doctors' websites and what are the must-have functionalities for a medical professional or healthcare practitioner, right? So whom is this video for? It's essentially if you're a doctor or if you're a doctor's marketing person and you're looking to create a new website and you're wondering what other functionalities you should have in your new website, A. Or if you're an agency, you've recently signed on a new practice, you're wondering what are the different functionality that should be there in their website. So this video is for you. We'll go through all the different functionality that should be in a doctor's website. Quick note, I have researched a lot of this, so you can also find all of this on ChatGPT. But you can, the purpose of this is that you can actually listen to it in your car, right, or when you're doing something else. So hopefully this will stay in your consciousness, right? So with that being said, and having given enough context to this lecture, I will begin with what are the different must-have functionality for a healthcare professional's website. Number one, homepage. Definitely, that's a no-brainer, right? You need a homepage, otherwise, where are people going to come? But make sure that homepage, that matters a lot. It's like the suit that you wear at a networking event, right? It's something that will make you stand out for good reasons or bad reasons, right? So you want to stand out for good reasons. So make sure your homepage is simple, clean, uncluttered, has clear navs, and has clear calls to action, right? There's a structure for home pages, by the way. You have the logo, the nav, the hero section, the social proof section, the services section. I think then you have the contact us section, and then the footer. Resources section, and then the footer. So it's this is at least what I follow. It's logo, top nav, hero section, social proof, services, resources, and the footer. So that's a good template to follow, right? Next, about us goes without, that's a no-brainer, especially if you are in a profession where your subject matter expertise is really important. You definitely need an about us section. You need all the bios of all the principals or the main people in your practice. Next is services. Again, goes without saying, especially for a healthcare practice, right? Because there's a lot of specialities, there's a lot of specializations, and you want to make sure that you showcase that on your website. Appointment scheduling, that's a simple plugin. You can use Calendly. It's a really good plugin from WordPress. People can schedule an appointment without having to speak to someone, right? That's huge, because every time you bring in a person, it's not good, because there's a chance of leakage there. So Calendly does that for you. Patient portal, again, HIPAA compliance. Keep in mind, all of this has to be HIPAA compliant. That's a topic for a completely new lecture. But remember, if you're a healthcare professional, all of this has to be HIPAA compliant. Patient portal, lab test results, scheduling appointments, private consults, all these things. Patient portal. Contact info, right? No brainer, your practice's location, hours, all that stuff. Insurance info, right? This is for both for insurance carriers also and for folks also who want to upload their insurance info through the patient portal. Blogs, again, showcase your expertise, news and recent updates, especially if you're working in a community, right? Within a community setting, people want to know what's happening. If you've done something, done any not-for-profit initiatives within the community, or if there's been some breakthrough research within your field, people want to know about that. So updates and news, right? Next is FAQs, especially for your industry. I think people have a lot of questions, right? So FAQ section always works really well. Next is testimonials. Now testimonials is tricky because testimonials in the healthcare industry have to be anonymous. You cannot have people disclose their name or their location, right, and their age. There has to be no way that anyone can identify who that person is. That's one of the preconditions of HIPAA. So if you're going to have testimonials, make sure that you retain that anonymousness of the person. Same for Google reviews or Yelp reviews. Please make sure your patients don't put in Google reviews or Yelp reviews with their name, because that's a HIPAA violation. Next is accessibility, right? This is both for ADA compliance, so folks with disabilities can access your website, and also from responsiveness, right? Your website should be able to be seen across browsers and different devices. Otherwise, there could be a huge swath of the population that's just not being able to get in touch with you. Privacy policy, no brainer, you can get that. There's thousands of templates for that. Online bill pay, interesting. Like any other small business, doctors' offices actually have a collections issue, right? So online bill pay just helps ease some of that problem because now people can pay online. Next is telemedicine, has been used since the pandemic. Here at Avion, we've actually worked on a few telemedicine apps, work wonderfully well, and I think that's the future. This is the future of medicine, especially in remote, remote places, in rural settings, or even in urban settings for disadvantaged communities who do not have access to good healthcare, in-person healthcare. I think telemedicine is huge, especially for preventive medicine, and especially for immediate care kind of things. Whether it's a fever or just something where it requires a consult. Telemedicine is going to act as something that eases the bottleneck, eases the supply side issue, because the reality is there's not enough doctors in the US, there's not enough nurses in the US, right? And they're all hamstrung for time. They really don't have time. There's 40, 50, 100 patients that walk in, and there's just 2 doctors and maybe 4 nurses who take care of them. Telemedicine makes sure, enables that to be spread wide and for more people to have access to a practitioner, which is amazing, right? Last is live chat, right? Again, like telemedicine, if you have a live chat, could be manned by a receptionist, or sometimes you could even think of outsourcing this or offshoring this to a different country. Again, helps to ease the bottleneck, right? So you have someone who is available, in a small practice, maybe 2 doctors, 4 nurses, maybe an X-ray technician, maybe a couple of reception, like an administration assistant. 5-10 people practice already. They have a lot of bandwidth issues. You don't want to add that with a live chat, so maybe you can offshore this. You can have someone overseas handle this, and this way your patients are happy because they always find someone who they can speak with on the website, and your in-person staff is also happy because they don't have to manage everything by themselves. They have some additional help in the form of these this offshore help. So there you go. Must have functionality. Before I go, and especially for this, I want to advise you that I am not an expert on everything. I'm not a lawyer, I'm not a doctor, so take all of this with a grain of salt. Do your research before you go ahead with any of this, right? Because unlike a lot of other professions within the medical space, there's a lot of restrictions, so do not take anything that I said as legal, financial, or medical advice. Always speak to a specialist within that industry before you go ahead. But if you're a medical practitioner who's looking for a website, give us a shout. We've helped a lot of doctors create websites before. Or if you're an agency, give us a shout as well. Chet here from Avion Technology. Thank you so much for staying on course with this. If you've liked the content, press like. If you want to subscribe, press subscribe, or hit the bell icon to be notified every time we upload a new video. Thank you so much, and you have yourself an awesome Tuesday. I'll see you tomorrow with a new video, and I will talk about a new industry. Thank you.